welcome back to Simply Women's Health with CJ. Today we're going to talk about a vaginal infection called Trichomoniasis, or Trich. Trich is a sexually transmitted infection. We've talked about in other videos about both bacterial vaginosis and yeast. Both of those are vaginal infections that are directly related to a shift in the pH, causing normal bacteria to overdevelop. Trich is actually a sexually transmitted infection that is caused by an itty-bitty little parasite that gets up into your vagina and can cause you to have some weird symptoms. Unfortunately, as it being a sexually transmitted infection, you always have to look at, what symptoms are you looking at? Men typically don't have any symptoms when they have Trich. Women, only 30% of women will show symptoms. The other 70% will be completely asymptomatic or not have any symptoms at all. Sometimes we find trichomoniasis on your pap smear, and that just says that you probably had it in there and you may not have even known about it. So if you do have symptoms, what symptoms are you looking at? You're looking at increased vaginal discharge. Typically the discharge has somewhat of a foul odor. It can smell rather fishy. The discharge may be white, it may be green, it may be gray, it may be yellow. Sometimes it can be real frothy or bubbly in nature. Some women with Trich will have pain when they urinate. Some will have lower abdominal pain. These are symptoms that can occur, and they're very vague. You see those with a lot of different things. So you think that you might have a vaginal infection. You go see your healthcare provider. They're going to want to do a swab, and they're probably going to want to get a thorough history when you come in. They may want to know what symptoms are you having, how long have you been having these symptoms. The thing about Trich can live in your vagina for weeks. It can live in there for years. They may want to know, are you sexually active? How many partners have you had in the last year? Do you typically use condoms when you engage in sexual activity? These are all things that your provider is going to want to know. They might want to do a swab, and they will send the swab to the lab, or they will look underneath a microscope in their office. And just for your own entertainment, just because I think it's fascinating, I am including a video of a sample of Trich when they do look underneath the microscope. Every time I've seen Trich, I find it fascinating. So I thought I'd share that with you. They may want to do a full STD panel, just because if you have Trich, again, it is a sexually transmitted infection, and if you have one, there is always a good chance you could have more than just one sexually transmitted disease. So how do you prevent getting Trich? First of all, you want to try to limit the number of sex partners that you have. You want to make sure that you're using condoms on a regular basis. If you are, if you have Trich, make sure that you tell your partners, again, and do try to use condoms consistently. I also recommend that you request a full STD panel on an annual basis if you are not in a long-term mutually monogamous relationship. If you are pregnant and you get Trich, it can make your cervix less, it can weaken your cervix, so it can actually lead to preterm labor. You can also, if you have Trich and you give birth vaginally, you can actually pass the infection on to your baby. So it is really important that you be aware of Trich and do everything you can to avoid getting it. Hi, if you're still here, thanks so much for sticking around through the entire video. If you feel as though this information has been helpful to you, or you think you know somebody that might benefit from the information provided in these videos, please feel free to like it, share it, and if you haven't already subscribed, I would love it if you did that. Any and all support that you can provide is so greatly appreciated. As always, these videos were not created as a replacement for a visit with your healthcare provider, rather as a place for you to come for basic, reliable information that is non-biased and hopefully allow you to figure out what questions to ask your healthcare provider at your next visit to best meet your healthcare needs. Again, I appreciate all of your support. If you want to contact me, my information is at the top of this screen, and I will put it in the comment section of this video. That's all I have for today. This is CJ. I'm at your cervix.